Today our topic is Horner syndrome, so don't forget to subscribe. Horner syndrome is a combination of signs and symptoms caused by the disruption of a nerve pathway from the brain to the face and eye on one side of the body. Typically, Horner syndrome results in a decreased pupil size or drooping eyelid and decreased sweating on the affected side of your face. Horner syndrome is the result of another medical problem such as a stroke, tumor, or spinal cord injury. In some cases, no underlying cause can be found. There is no specific treatment for Horner syndrome, but treatment for the underlying cause may restore normal nerve function. Horner syndrome is also known as Horner-Bernard syndrome or oculosympathetic palsy. Its symptoms: Horner syndrome usually affects only one side of the face. Common signs and symptoms include a persistently small pupil, also called miosis, a notable difference in pupil size between the two eyes, also known as anisocoria, little or delay opening dilation of the affected pupil in dim light, drooping of the upper eyelid, ptosis, slight elevation of the lower lid, sometimes called upside down ptosis, little or no sweating, anhidrosis either on the entire side of the face or an isolated patch of skin on the affected side. Signs and symptoms, particularly ptosis and anhidrosis, may be subtle and difficult to detect in children. Additional signs and symptoms in children with Horner syndrome may include lighter iris color in the affected eye of a child under the age of 1, lack of redness, flushing on the affected side of the face that would normally appear from heat, physically exertion, or emotional reaction. Other signs and symptoms are impaired vision, dizziness, muscle weakness or lack of muscle control, severe sudden headache or neck pain. Causes: Horner syndrome is caused by damage to a certain pathway in the sympathetic nervous system. The sympathetic nervous system regulates heart rate, pupil size, perspiration, blood pressure, and other functions that enable you to respond quickly to changes in your environment. The nerve pathway affected in Horner syndrome is divided into three groups of nerve cells: neurons, first order, second order, and third order. First order neurons. This neuron pathway leads from the hypothalamus at the base of the brain, passes through the brainstem and extends into the upper portion of the spinal cord. Problems in this region that can disturb nerve function related to Horner syndrome include stroke, tumor, disease that cause the loss of the protective sheath on neurons, myelin, neck trauma, cyst or cavity in the spinal column, phalangomalia. And in second order neurons, this neuron path extends from the spinal column across the upper part of the chest and into the side of the neck. Causes related to nerve damage in this region may include lung cancer, tumor of the myelin sheath, carcinoma, damage to the main blood vessels leading from the heart, aorta, surgery in chest cavity, traumatic injury. And in third order neurons, this neuron path extends along the side of the neck and leads to the facial skin and muscles of the iris and eyelids. Nerve damage in this region may be associated with the following: damage to the carotid artery along the side of the neck, damage to the jugular vein along the side of the neck, tumor or infection near the base of the skull, migraines, cluster headaches are disorders that result in cyclical pattern of severe headache. And for the children, the most common causes of Horner syndrome in children include injury to the neck or shoulders during delivery, defects of the aorta present at birth, tumor of the hormonal and nervous systems, neuroblastoma. Unknown causes. In some cases, the cause of Horner syndrome cannot be identified. This is known as idiopathic Horner syndrome. For diagnosis, we need some CT scan or MRI. And for children with Horner syndrome, doctor may order blood and urine tests that are used to diagnose a tumor of the hormonal and nervous system, neuroblastoma. Treatments: there is no specific treatment for Horner syndrome. Often Horner syndrome disappears when an underlying medical condition is effectively treated. Be safe and healthy.